As a man over 50, you might have noticed that your body doesn't respond the way it used to, even if you haven't changed how you care for yourself. Things that worked flawlessly for decades might now cause unexpected issues. Many men find these changes frustrating, worrying, or even embarrassing, often hesitating to discuss them, even with their doctors. I'm Dr. Sophia Carter, a urologist with over a decade of experience. Each month, I see hundreds of men in my practice who share these concerns. I'm here to guide you through a simple, practical 3-step daily routine designed for men over 50 to help you feel better and function optimally. This isn't about costly treatments, invasive procedures, or drastic lifestyle overhauls. Instead, it's about straightforward habits you can start today to address the natural changes happening in your body. By the end, you'll understand what's going on, why it's happening, and how to take control of your health with confidence. Let's begin by exploring what's happening in your body after age 50. Understanding the underlying causes makes the solutions clearer and more actionable. Think of your body like a well-built house you've lived in for decades. The foundation remains strong, but some systems like plumbing or electrical require more maintenance to keep everything running smoothly. As you age, several key changes affect your health, particularly in areas many men find sensitive to discuss. First, your testosterone levels naturally decline, starting around age 30 at a rate of about 1 to 2% per year. By 50, this gradual decrease becomes more noticeable, affecting energy, strength, and other functions. It's not a sudden drop, but a slow shift that requires you to adapt your approach to stay at your best. Second, your circulation changes over time. Blood vessels, especially the smaller ones, may not deliver blood as efficiently as they did in your younger years. This is a normal part of aging, but it's critical in areas where healthy blood flow is essential for proper function. Third, your body's tissues lose some elasticity as you age. Just as the skin on your face might need more moisture or care, other tissues also benefit from extra attention to stay healthy and comfortable. These changes don't mean you're broken or deficient, they mean you're human. Like any complex system, your body thrives with thoughtful, consistent care. The 3-step routine I'm sharing addresses these changes in practical, accessible ways that fit into your daily life. The first step focuses on boosting circulation, something you can incorporate discreetly without disrupting your schedule. This step has 2 components that work together to enhance blood flow and overall vitality. The first component is movement, but don't worry, I'm not asking you to train for a marathon or join a gym. Instead, commit to a 10-minute walk each day with a specific focus. As you walk, gently engage your core muscles by pulling your abdominal muscles inward, not strenuously, but enough to feel a subtle activation. Breathe deeply as you move, letting your breath flow naturally. This simple practice creates a gentle massage effect for the blood vessels in your pelvic region, improving circulation and giving your system a daily tune-up. Many of my patients report feeling more energized and alert throughout the day after adopting this habit. The second component is mindful breathing, which you'll practice 3 times a day for just 2 minutes each session. You can do this while sipping your morning coffee, during a work break, or while relaxing in the evening. Inhale slowly through your nose for 4 counts, hold for 4 counts, then exhale through your mouth for 6 counts. Repeat this cycle for 2 minutes. This breathing pattern activates your parasympathetic nervous system, which promotes relaxation and widens blood vessels for better blood flow. It's a simple yet powerful way to support your body's natural processes. What makes this step so effective is its simplicity: no equipment, no special skills, and no one needs to know you're doing it. You're just being more intentional about the things you already do, moving and breathing. The second step in your routine is about upgrading your hygiene habits in a way that supports your health as you age. This isn't about being cleaner than you already are, it's about being smarter to prevent issues that become more common with age. As you get older, your skin becomes more sensitive and prone to dryness or irritation, especially in the genital area, which has fewer oil glands than other parts of your body. Harsh soaps or products that worked fine in your 20s or 30s might now cause discomfort. Here's how to adjust your approach. Switch to a gentle, fragrance-free cleanser designed for sensitive skin. You don't need an expensive product, just something mild that preserves your skin's natural oils. When showering, use lukewarm water instead of hot, as hot water can strip moisture from delicate skin. After cleansing, gently pat the area dry with a clean towel rather than rubbing vigorously, which can cause irritation. Then, apply a small amount about the size of a pea of fragrance-free moisturizer designed for sensitive skin. This step might feel unfamiliar, but it's critical for maintaining healthy skin. Moisturizer helps protect the skin's barrier, prevents chafing or irritation, and keeps the area comfortable. This small change takes less than 2 minutes, but can prevent problems like itching, dryness, or even small tears that could lead to infections. In my practice, I see many issues that could be avoided with this simple upgrade. Prevention is always easier and more comfortable than treatment. The third step focuses on supporting your health from the inside out through practical nutritional choices. I'm not asking you to overhaul your diet or follow a restrictive eating plan. Instead, I'll share 3 targeted strategies that directly support the health concerns we're addressing. The first strategy is improving your hydration, which many men overlook. Dehydration affects circulation, energy, and overall well-being, so let's make water intake strategic. Start your day with a full glass of water as soon as you wake up. After 8 hours without fluids, this hydrates your body and jumpstarts your circulation. Then, drink another glass about 30 minutes before each meal to support digestion and help you feel satisfied. Aim for clear or light yellow urine as a sign of proper hydration. Dark yellow urine indicates your body needs more fluids. The second strategy is to include 1 serving daily of foods that naturally support circulation. You don't need to memorize complex lists or change your entire diet. Choose simple options like a handful of nuts, a piece of dark chocolate, a serving of berries with breakfast, or leafy greens with lunch or dinner. These foods contain compounds that keep blood vessels healthy and flexible, acting like fuel for your circulatory system. Patients often tell me they feel more energetic and notice improvements in their overall health after making these small additions. The third strategy is about meal timing. Many men eat their largest meal at dinner, but your body processes food more efficiently earlier in the day when your metabolism is more active. Try making breakfast or lunch your biggest meal and keep dinner lighter. This can boost energy, improve sleep, and support better circulation. These nutritional tweaks are straightforward but impactful when practiced consistently. Now, let's tie these steps into a daily routine that feels natural and sustainable. The beauty of this approach is that it doesn't demand large blocks of time or major lifestyle changes. Your morning starts with a glass of water upon waking, followed by your 10-minute walk with core engagement and deep breathing. Then, during your shower, use your gentle cleanser and apply moisturizer afterward. This morning sequence takes about 15 to 20 minutes and sets a positive tone for your day. Throughout the day, you'll do some more 2-minute breathing sessions perhaps during a coffee break and in the afternoon. You'll also stay hydrated by drinking water before meals and include 1 circulation-supporting food in your diet. In the evening, complete your final breathing session while relaxing. If you shower at night, apply your hygiene routine then. That's it, no complex protocols, no expensive supplements, just simple habits that add up to about 30 minutes daily. Consistency matters more than perfection. If you miss a day, don't stress, just pick up where you left off. The goal is to make these practices a seamless part of your life, not a source of pressure. Many of my patients notice improvements within weeks of starting this routine. They feel more energetic, confident, and comfortable in their bodies. Some see better health markers during doctor visits, while others simply enjoy a greater sense of well-being. To help you stick with this routine long-term, here are some practical strategies. First, start small. Focus on one step for the first week, add the second step in week 2, and the third in week 3. This gradual approach makes the changes feel manageable and builds lasting habits. Second, tie new habits to existing ones. Take your walk after your morning coffee, do breathing exercises during downtime, or incorporate your hygiene routine into your usual shower. Linking habits to routines you already follow increases their staying power. Third, focus on how you feel rather than checking for specific changes daily. Notice your energy, comfort, and overall vitality. These improvements often build gradually. Fourth, be patient and kind to yourself. There will be days when you don't follow the routine perfectly, and that's okay. Progress, not perfection, is the goal. Finally, view this routine as an investment in your future. The habits you build now will support your health and vitality for years to come.